Good morning, everybody, and welcome to the Georgia Indo-American Chamber of Commerce series on webinars on the COVID issue. Today, we are going to speak about the topic of medical updates and the workplace integration across borders perspective. And to further introduce the group, I would like to now introduce our chairman, Ms. Anita Ninen. Take it away, Anita.
Okay, have we got my... Hello, everybody. Welcome to this webinar. I'm very, very pleased to welcome our expert panel of speakers. Our event partner, the Canadian Consulate of Canada in Atlanta, our attendees, and of course, our GIACC board members. The GIACC is a business chamber which has been around for the last 20 years. Our primary mission and goal is to encourage trade and business opportunities between India and the US, and specifically the state of Georgia. We work very closely with the Indian Consulate General of India in Atlanta in terms of our events, our programs, as well as in hosting delegations between India and the US. Our membership consists primarily of small and medium-sized businesses. And we also have in our membership a few large corporates such as ICICI and UPS. We have a large number of professionals such as bankers, lawyers, accountants, CPAs, to name a few. I hope you're going to enjoy this third webinar in our COVID-19 series, and you will find the presentations and the discussion useful and informative as we all try to navigate our personal and professional lives in this extraordinary time. So thank you again, David, and I hand this back to David and to our presenters.
Thank you, Anita. And sorry I didn't introduce myself. I'm your moderator today, David Gault, and a past president and board member of the GIACC. And we are going to have a very vigorous schedule here of information and very interesting speakers. So I'd like to first introduce Dr. Sivakumar, who is a pulmonary specialist who has been on the front lines of the COVID-19 crisis. He is currently an active doctor every day with COVID patients. He comes from western part of Massachusetts. And he has many good stories and information about what it's been like on the front lines for the last 12 weeks. So without further ado, Dr. Siva, please take it away.
Good afternoon for the people in US and good evening for the people in India. My name is Sivakumar. I was born in Tanjore, India. I grew up and did my medical school in India and then came for training in England and then on to the USA. I've been in pulmonary, which is lung diseases, and critical care, which is intensive care unit practice for the past 20 years. I practiced in Texas for the first 10 years, and then we moved on to the Northeast. And over the past 5 years, I've been traveling and worked in multiple ICU setups, which range from a 5-bed to a 100-bed ICU. And we've been seeing a spectrum of critically ill patients. And COVID came over since the early part of the year. And it has been a long journey so far. 3 months looks like 3 years now. And in this, I would like to focus a little bit on the prevention and the vaccination we're just being talked about everywhere. More importantly, I would like to tell a few points on hospital management, what we do in the ICU, and how the patients get discharged, and also to touch upon some points on advanced care planning, like living will, DNR, DNI, which means do not resuscitate, do not intubate, advanced planning. So, as you may know, majority of the people have a self-limiting illness once they get the virus. They have a simple viral illness. Majority of them don't even know they may have it. They may be asymptomatic, or they may have a mild illness like a cough, some low-grade fever, or a cold, so sometimes diarrhea or vomiting, and so some non-specific symptoms can occur. And those kind of people recover by themselves if they are otherwise healthy. A small fraction of them can get sicker and they may need hospital treatment. And most of them need some form of supplemental oxygen therapy. And a minute fraction get very, very sick and they have to go into the intensive care unit where they may need more advanced forms of oxygen support to support the function of the lungs when their lungs fail. Those kind of patients are also prone to have other organ failures, particularly kidneys or liver, the heart, and also the brain. And if they end up needing the ventilator, then their prognosis gets poor, and they can be a setup for additional complications. And what we are seeing is these patients are now in the ICU for 30 days, 40 days, sometimes 2 months. And some of them unfortunately go on to die. And so some of them can die even earlier in the course of the illness. So the course of the illness has evolved, and we have learned a lot from what happened in China, then in Italy, then and in New York. So the treatments have been changing, the recommendations have been changing, and the guidelines initially were changing by the day or by the week, and then we are still going through a lot of evolution. I'm told that my camera is not that clear. I'm trying to see if there is anything I can do, but I can't find anything.
Dr. Siva, you're visible clearly. Please continue.
Is it okay?
Yes, we can see you clearly.
Okay. All right. So where were we? So the course of the illness in the ICU can be prolonged. Before the COVID, we used to do procedures like tracheostomy for those who are on a ventilator by 2 weeks' time. But now we are leaving them up to 4 weeks or even for 5 weeks. And many of them have actually recovered by 2 months' time. Having said that, that is not the norm. We're very elderly people who have other underlying conditions like dementia or bad diabetes or heart failure or lung disease. They don't do that well. So if they are elderly, we are talking about their goals of care earlier in the course of the illness and seeing what their loved ones want to go through at the end of life. So that is a touchy subject, and to add to the problem, none of these family members are allowed to come into the hospital or the ICU. So they are unable to see them or to talk to them, and the patients are in isolation. what we have done to overcome that is to provide FaceTime opportunities where we have iPads and we are calling the family once, twice, or sometimes 3 times a day. And so some of them are curious and they call frequently.
You have about 1 minute.
Okay. So, it is a changing dynamic picture in the hospital and the ICU. We have had several success stories. The first patient I saw as a consult for COVID actually went home in 3 days with a simple illness, and then the next patient was close to dying, and we transferred them to the university hospital, and 4 weeks down the road, they got discharged and went home with no oxygen. So that does give some gratification for the work we do. And I'll stop here and then I'll be available for questions. Thank you.
Well, great. Thank you very much, Doctor. And those are some interesting stories from the front lines, working every day and still working for all of the even new developments of COVID. We can get back to that later. Moving on, I'd like to introduce to you Dr. Piyush R. Johari. He is a psychiatrist, educated in India, in Mumbai, then traveled to the UK for further studies, and then entered America at the Mayo Clinic in Minnesota. And since 2003, he has now been in the Springfield, Massachusetts area, in also Western Massachusetts. And he will give us some background on the psychiatric and psychological conditions of the COVID situation. Dr. Johari, please take over. Thank you.
Thank you. Thank you for the invitation, and it's a pleasure to present my experience and reflections. It's a big topic, and I figured when I was thinking about what I should speak about, some of them are personal experiences I've had since COVID started, and some of it is based on the trends in the profession that we are seeing. So I'll just touch upon the trends that we are seeing now, and then what do we do about it, we can talk about in the question and answer sessions. I figured I'll divide it at a personal level, at a more social level, and then some general reflections. So at a personal level, there is undoubtedly been a marked increase in stress and anxiety, which is very understandable when people are faced with an unusual, unknown, unknowable thing. There's a lot of fear and paranoia. That is quite understandable. Fear is okay, panic is not. That's what we've been telling people, that, just calm down, we're getting more information and things will be better. From a mental health perspective, it's been difficult for many, many people at different levels. We have noticed an increase in substance abuse. People are drinking more, and there have been more prescriptions of anti-anxiety medications and even antidepressants. There was a news report that Zoloft, a commonly prescribed antidepressant, they were short of that. So that is a good sort of indirect barometer of people's mental health. We have known for some time now, over the past 3 months, it became evident fairly quickly that certain people are vulnerable at this COVID time. I think you all know about the elderly for obvious reasons, age being one, and the whole process of not being able to see relatives. But even not the elderly, but people who are sick, how do you care for them? People at home, how do you care for them? A lot of patients have been, and my clients have been very distressed about this. So that came up. Very early on, I work in a hospital, so very early on, we realized that, for example, daycare is a problem. A lot of our nurses, some of my colleagues, they're single parents, or their husbands are away, or spouses are away. they were willing to come to work because they're essential workers, but daycare became a problem. So we had to problem solve that. That was a unique problem which not many people sort of foresaw. Generally speaking, we noticed that people with, poorer social networks, people who live alone, people who don't have too many friends, they tend to have a harder thing. And we also know from previous experience at times like this that the suicide rates go up. We do not have any data of that with COVID. It's too new. I'm sure the data will come later. But at times of great economic upheaval, one can expect the rates of completed suicides, unfortunately, and attempted suicides go up. We see that. But all is not gloom and doom. I was reflecting on the change in my own practice. Telehealth being the most prominent one. I think some of you must have seen your doctors remotely and through audio video conferencing. This is not a new space, especially for mental health. We've been doing it for a while, but now we've been forced to do it. In my own practice, for instance, I was going to do it, and I kept postponing it because there was no compelling reason to do it. So, but here we were with COVID, and overnight, literally on the weekend, we had the platform running, and now a lot of telehealth is being done. Telehealth is interesting because it has created opportunities for business people, but also patients, because, for example, access has improved actually. For instance, in Massachusetts, it snows a lot, unlike Georgia, but every year I lose about 5 working days to snow and bad weather of other kinds. And now that's not going to be the case. I could just call up a patient and have an audio video conference. So in a lot of ways, I think access is going to improve. This is a new space. It's exciting. It has its pluses and minuses, but we'll see. The other sociological trend, which is upsetting and distressing, and I'm sure you must have read reports about this, is scapegoating, and particularly ethnic scapegoating. Indians have not been mainly targeted for this because the virus came from China, but it's unfortunate, and it distresses people and society. But the Asian American, network of people, there are studies to show that there have been at least 1,500 documented hate crimes, all the way from verbal abuse to assault. I have not read any reports of murder, but thankfully that is a good statistic as of now. The role of social media has been, controversial. It always is controversial. There's pluses and minuses. The way I look at it is, one has to kind of separate the signal from the noise, and leave it at that. That is a topic for a whole different seminar. Other reflections that, I thought about were, the history of pandemics. I mean, some of you must have read about past pandemics. They're unpleasant, but they don't last forever. And I think we have to have a somewhat philosophical and historical perspective to gain some resilience and optimism and future orientation. I'll leave it at that, and I'll be ready for questions when my time comes around. Thank you.
Thank you very much, Dr. Johari. And yes, we'll look forward to some Q&A after we're done with the rest of the panelists. And thank you. I'd like to now introduce to you our Canadian friends from Miss Julie Johns. She is the Human Resource Manager of the Lambton Conveyors Limited Company. It's a manufacturing company in Ontario. And Julie is going to give us some perspective on how it is in the workplace coping during this very strenuous season. So Julie, take it away.
Thank you, David, for your kind introduction, and Georgia Indo-American Chamber of Commerce for giving me this opportunity to be part of this webinar. A very warm welcome to everyone watching the webinar. We are fortunate to live in Chatham-Kent. Now, Chatham-Kent is in southwestern Ontario, and currently we only have 4 active cases. We had 152 total cases, 147 have recovered, and there was 1 death. But business is not as usual because we are waking up to stats, facts, and myths around COVID-19. From the HR perspective, we must remember that our staff is our #1 asset, and we need to look after them. Today, I would want to cover in a nutshell some HR issues like onboarding, people management during change, workplace health and safety, and performance management. The guidelines that we received from the Public Health Agency of Canada were used at Lambton Conveyor Limited to address and educate our workforce. Lambton Conveyor has been ahead of the curve by sending the first travel advisory on January 29th to all our employees with respect to travel, specifically to China, because we also have a subsidiary in China. On March 7th, our second company announcement was sent to all the employees with details about COVID-19, the virus, and how we should be aware of making sure that we maintain self-distancing and also hygiene among us. And these were also received from the Public Health Agency from Canada. We also posted this information on all notice boards and every station specifically for our plant employees, and making sure that we provide them with hand sanitizers at every station and educate them about washing hands frequently. The company announcements were also sent to employees traveling during this time because it was during the spring break, and to make sure that they self-quarantine themselves for 14 days when they come back from the travel, and to come back to work or report to work only if there are no symptoms. On March 17th, the Government of Canada declared a state of emergency, and the senior management team came to a decision about remote working. The employees were asked to work from home immediately, but the only problem was we have a plant employees who cannot work from home. They have to be at work every day. And we wanted to make sure that they feel safe when they come to work. We have a health and safety talk every morning with our plant employees. And the supervisors made sure that the employees always work with a 6 feet distance between them. We also have barriers in place so that the employees do not work in groups, but work at separate stations. The changes that we saw in workplace, work environment during the post-COVID-19 was that all the supervisors and managers were asked to have limited conversations and less physical involvement in the plant. All conversations were asked to be done through email or through phone versus in person whenever possible. There were cleaning services that were added to make sure that the entry and delivery points were disinfected and controlled on a daily basis. Recruitment and onboarding had to be done differently. All the interviews were done through either phone or through video calls. We only made sure that if we had a perfect candidate, and only then they were called to our office. The personal interviews were also done with clear protocols, like maintaining the distance, using hand sanitizers before and after the interview, and to make sure that there is cleaning up done before and after the interview was conducted. There were many challenges that we faced during this transition because we had to keep the manufacturing plants open and working during the pandemic. We were fortunate to be in Chatham, and on March 24th, the Ontario government announced shutdown of non-essential businesses. Fortunately, our plant is deemed essential services, so we didn't have to shut down even a day. While as a team, we have taken precautions to prevent the spread of COVID-19, we continue to implement additional steps on a daily basis to prevent the contagion by maintaining social distancing at workplace. The managing risk to ensure business continuity and driving productivity at distance, which is so difficult right now. But the 3 areas of focus that help us ensure business continuity are number 1, formalizing and standardizing operating procedures. We also conducted COVID audits on a daily basis for the first 4 weeks, making sure that we take pictures of every employee, where they are placed, or they're working with, to know what time they were there. So we had pictures taken every day as part of our COVID audit. We made sure that we build workforce confidence through 2-way communication that responds to employees. made sure that employees can ask questions to their managers, and managers always would reply back to them, so that there is no fear, there is more clarity in terms of what performance expectation is. Anticipating potential changes and modeling the way the plant should react well ahead of the fluctuations to make sure we enable rapid and fact-based actions. To drive productivity at a distance is not easy, but we've managed pretty well so far. Continuing to effectively manage performance at the plant by maintaining the social distance, or specifically with remote working employees by having a remote working policy in place. Now, finally, the best communication is two-way communication, with managers answering questions, engaging in an open dialogue with the employees at all levels to make sure there is clarity. Keeping your team's spirits up and high should be the topmost priority of every manager, team leader, or a supervisor. Communicating with your team daily and allowing flexibility to your employees because they're managing work, also, and they're working from home. So it's not very easy. They have the children because the schools are shut. They have the online classes. So how do you manage work from home? And your spouse is working, you're working, you're on calls, you have conferences happening. So we, as an employer, it is very important to make sure that we give them flexibility and understand the situation and make sure there is no stress involved. Thank you. Also ensuring the employees know what is expected from them in terms of performance, because if there is no clarity, employees would not be able to perform well. For our plant employees, we make sure that because they were physically present at Lambton every day, we awarded benefits like gift cards for every pay. So every pay they were given gift cards and for recognizing their efforts to coming to work every day, having no fear. And I believe the employees really, really appreciated it. Thank you, David. I would like to hand it back to you and answer any questions that we have at the end.
Thank you, Julie. That was a very good report on keeping the business running during this time, and a lot of good insight on, keeping people separated despite a heavy manufacturing schedule. So thank you, and I'd like to now turn the video over to Mr. Butch King. Butch has a lot of duties at the Rane Precision Diecast Company, which is involved in high precision aluminum diecast manufacturing in Russellville, Kentucky. Butch has a long career in business and also working overseas with the Department of Defense. And he has a lot of hats here at Rane. It looks like he is not only the human resource manager, who's confronting all of the personnel issues, but also running the factory. So Butch, tell us a little bit about your company and the issues that you've confronted lately. Thank you.
Okay, thank you very much. Warm welcome to everyone near and far. We appreciate this opportunity to speak here to you today. As I was introduced, I am Maurice King, or I go by Butch. I do wear many hats here. Most people refer to me as the firefighter here at the plant. I feel the HR manager role, the production manager role for the machine shop, and my boss, my direct boss, our business head, he was stuck in India for the last 3.5, 4 months. So I've also been acting in his stead in his absence on many issues. Some of the challenges that we face here, if you will, are social distancing. Everybody's at home, they're practicing this stuff. It's put out through all the local communications, the news networks, the social media. But when the people come here, and one of the things here, we're in a small rural area, we have a lot of family members here. And for some reason, they seem to forget that social distancing also takes place here. And quite often, we have to remind couples or moms and sons or moms and daughters, hey, you still have to maintain your social distancing. The state and the local community that rides by the plant, they don't know you're related. They just know that we have to maintain our social distancing in this manufacturing environment to maintain business, to stay open. and to prevent the spread of the COVID-19. So that's a big challenge, something that we faced a lot of questions on two or three times a day from the different shifts. The next thing I would say that we were faced just the day before we opened, I got a call from a friend that worked at the Kentucky OSHA state level office, and he reminded me or asked me if we had cut off our water fountains. Some people in the north call them bubblers. We had not. That's something we'd overlooked. And so at the last minute, we went through, disconnected all of our water fountains, covered them up with plastic bags, and we ordered some 20,000 water bottles. There was challenges in that as well, getting them in here, keeping them cooled for drinking, and then finding that the bottles that we ordered, most people were just taking a few sips out of the bottle and then throwing away everything else. So that was another thing that we tried to address. Since then, we changed our orders to much smaller bottles so that we consume that. Face masks. The company ordered, paid for cloth face masks. As many of the medical people know, the N95 masks, the respirators are out there for use by them. We allow the cloth face masks here. We've issued out to each employee at least 2 cloth face masks. And then as the state came online with their manufacturing requirements, as well as opening businesses back up in the communities, we issued each person an additional face mask for a family member, just trying to raise their morale a little bit there. Leading from the front, one of the things I was able to convince my boss to do in India through the internet and telephone calls was to make a video. I wanted him to make a video welcoming back our employees that we had laid off, and here we are, we're starting back up. So that was received with great success from our employees, and has since we've had a couple videos from him to the employees, not just the staff here in the management ranks, if you will. And that's been a very positive thing. Communicating and educating. We're in constant communication with our employees, whether it's changes in SOPs with regards to COVID-19 operations, if it's changes in federal and state requirements, the CDC, the federal OSHA or the state OSHA, we post changes out here at the entrance where people can see them on a daily basis. We provide information that can also be used by family members at home. As Julie had talked about, keeping people's morale up, realizing that people have families, not everyone's situation is the same, making information available to everyone so that they can also carry it home with them is something we found to be very positive here. We also provide daily updates on statistics with regards to city, county, and state info on the COVID-19 operations. And then additionally, as far as the communication and education, keeping up, following up on SOPs, making sure spot checking, having supervisors spot check employees, and then the managers also check our staff, making sure, that they're reading and actually following the stuff that we're putting out. And so that's also been a big help here. Open door policy here. All the supervisors and managers have an open door policy. We strongly encourage a see something, say something environment, if you will. And so if you see me, if I'm walking across the floor and an employee sees me and I'm red-faced and I'm sweating and I'm coughing and I don't look like I'm doing too well, anybody can come and say, hey, Butch might need to get checked out. We encourage people to be on the lookout for COVID-19 symptoms, all right, that we can help each other out. And if things are identified, we take the appropriate actions. Okay. Being flexible with our workforce. That's something that even started before our shutdown. As the COVID-19 stuff started hitting here in the States, there was a lot of people still getting symptoms of flu as well. And so some of the things we would do here is we would send someone out to the doctor, let them get checked out, be flexible and bring them back that doctor's excuse, because we know the doctors were getting really busy and everything, but also maintaining some flexibility because we know schools were closing and people were having to react differently. It wasn't just leaving at this time to meet the school bus. Now that schools are closing, people are trying to find childcare for their children and react to all this. So we've been pretty flexible in that. And that flexibility is remembered, I believe. I've talked to people in other companies where they've had issues trying to make hard decisions and force employees to choose between their job on that particular shift or a family situation. And that's just not right. So we try to take care of our families in that way.
Very challenging times, Butch. Thank you very much for your report, and appreciate that.
Yes, sir.
Again, operating under not the most ideal environment, but still operating and still taking care of all your employees. So we'd like to open up now any questions to the panel. There's a chat button on below, and I would welcome anybody to send in some questions right now. One question we have for Dr. Siva. Give us an idea on the costs of treatment for people with COVID, at least that you see coming in to your give us some idea of the hospital costs, but some of the other costs to be in the hospital. Give us your perspective.
Sure, it's a good question. It's quite practical. Everybody would be concerned in the day of insurance coverage and no coverage. The cost varies. It depends if you're just coming to be admitted in a general medical ward where you might just need some IV fluids or supplemental oxygen or some simple antibiotics, and then you recover and go, versus the extreme case where you have to go into the intensive care unit. You have to require mechanical ventilation and a lot of associated procedures and operations and then recovery. So it also varies on a day-by-day basis. It used to be that the cost per day for any ICU care, it used to be like $2,000 to $3,000. It's a very approximate number. It may have gone up now, and there is no hard data yet. So some state that hospitalization can be up to $15,000, maybe more, maybe less. But as of now, the insurances are covering them until about September 30th. This is subject to variability.
Thank you.
Yeah.
Thank you. Good. How about you, Dr. Johari, as far as on the psychiatric part of treating your patients? You did mention a lot of, web consultations, but has there been some new policies that have helped, your patients get access?
Yeah, I mean, most of the work that has had a direct impact from COVID is outpatient work. And that is, the cost of an office visit, which can, depending on, it's time sensitive. So if it's a 20-minute visit or an hour, it can vary anywhere from, $100 to more, 225, 250, depending on the insurance, whether it's public or private insurance and so on. But that is generally the range. Under the COVID emergency authorization, they have relaxed rules. For example, co-pays, people who have insurance, co-pays have been waived. In other words, the insurance company will pay the co-pay, so that has been a relief for some patients. So some of the rules and obstacles, we used to think there were obstacles where you needed prior authorizations for visits. That has all just crumbled. And even with telehealth, things have crumbled. You know, you couldn't do, you had to do HIPAA compliant video conferencing only. For now, that has been relaxed because a lot of people don't have internet access. So you could literally have an audio only visit and still charge Medicare or the local. For now, it is okay. I'm sure it will change, but as of now, there's much more flexibility.
Thank you very much. Changing direction here, what about some of the lessons we've learned in operating a manufacturing group? I'm going to point this question to Julie and to Butch as far as what could we have done, or what measures have your company done to prepare for another pandemic or another situation? Julie, why don't you give us your perspective, and then
Thanks, David, for that question. So many businesses, large and small, have been resorting to temporary layoffs because of COVID-19 and also the impact of the economy. So the federal government here in Ontario has created a number of programs for employees as well as the employers. So there's employment insurance, which is paid to employees. These are benefits, and also there's a Canada Emergency Response Benefit, which was started because of COVID, and there's Canada Emergency Wage Subsidy. Now, for individuals who are asked to let go, they're asked to let go of their jobs, and they're also entitled to additional compensation. So on April 11th, the federal government passed legislation providing clarity on the Canada Emergency Wage Subsidy. So employers who suffer a drop in gross revenue of 15% to 30% compared to 2019 can access the subsidy. So you can also use different other benefits that the government provides. So we don't see that as a problem, but we see that as a benefit from the federal government, and making sure that if we have our protocols in place, making sure that our operations are regulated, are in place. I think we can be way ahead of the curve if we have a second wave.
Thank you very much. That's a very sounds like they're trying to work through the regulations right now. Which, how is it looking now in the state of Kentucky? Since every state is having their own regulations now for dealing with personnel issues, and what are those costs involved that you're going to be confronting now and in the future for preparing for the future events?
Here, the state's opening up more and more businesses from a federal level. The state, we do have unemployment insurance. We did lay people off for a while, and so they have unemployment insurance there. Those people that are subject or fall in one of 6 groups under the Family First Coronavirus Act, there are resources there for them for pay purposes. Also, if someone's childcare suddenly closes down, there's resources there for them as well. We have emergency paid sick leave that lines up under the Coronavirus Family First Act. So there's some things there available to people. We've not had any problems. Probably the biggest challenge, a lot of our employees, for one reason or another, have not been paid their unemployment insurance, although they filed for it. And I know in the state of Kentucky, I've seen news on some investigations going on where a lot of people have not been paid properly. So I'm sure we'll learn more about that in the days that come. As far as something happened here, again, we have a pandemic response team we put together with about 6 people. Each of them have a role. So, I mean, we just kind of follow those guidelines, and I think we're well prepared should something happen again.
Tell us, what kind of costs you are seeing now for not only supplying your employees with personal protective equipment, you said changes in water and hydration as it goes into summer, and then other things. Have there been any other regulations now that will, I'm sure insurance is a huge unknown right now, but is there anything foreseeable right now that you're going to be confronting in the near future?
In the near term, I don't see anything right now that's going to hit us. We have, because of the business we're in, supporting the automotive industry, a lot of customer orders are down in the automotive market. And so right now, we're right at the gate of making the decision on reducing the workforce again as part of the reaction to the overall COVID operations. And so we're probably going to cut back here. We'll lay some people off. Again, they'll be afforded the appropriate insurance, or whether it's unemployment or FMLA, extended FMLA under the Family First Act. So there's programs and resources available for them.
Thank you very much. We'll swing back to Dr. Siva.
Yes.
You've been on the front lines. What is everybody's question now as businesses are opening, people are moving around? What is your prognostication about a second wave or a continual, trend as far as people concocting COVID?
Well, my personal belief is that it will surge again. And I see a lot of people out in the community not wearing masks, not practicing social distancing as much as they should. And we are seeing the spike of cases in many places. So we should be surprised if we see an increase in the number of cases as well as hospitalizations.
Well, we're hoping that there will not be a huge spike, but it obviously, until we have a cure, this is what will happen.
Right.
Tell us also, Julie, with all of this new information of employees having COVID, working from home, there's a lot of confidential information. Tell us, how is it at Lambton and within Ontario and in the Canadian government, direction on how we're going to keep it confidential?
Yeah, so we have a work from home policy, which is already in place, and it has been shared with the employees, so they know what they have to do. And it has been very clear to them that if they are working from home, they have to use a laptop, which is given by Lambton. They cannot work on a computer or a laptop or a personal computer or laptop. So it has to be provided by Lambton. The IT, we are making sure that they receive all that they want, the help that they need, so that they can work from home. In terms of confidential, because they already signed a confidentiality agreement with us. So we believe and we trust in our employees that they will make sure that it's confidential and they will talk about it or they don't share anything with outsiders or outside the company. And right now, we see most of the employees, they want to come back to work. We've had plans and programs in place where the team can decide when the employees can come to work on an alternate day basis, so that they don't have to sit closer to each other, or they can maintain the safe distance. The team decides how they want to work it out, and if the manager feels that the team member can work from home and is performing very well, it's up to the manager to decide that.
Thank you very much. It's a challenging time right now. Dr. Johari, there's a lot of talk about people are at home. You know, there are always problems, good and bad, of being alone. Children, you know, home with their parents. Tell us, in your area, what are the outreach programs on the psychological basis of helping people not only with you know, issues of depression, as you said, Zoloft has spiked, but what other measures are there for the general public that you and your local area are helping?
Right. I mean, the principles of good mental health care essentially don't change, and we continue to reiterate that, you know, keeping it simple, sticking to the basics. One of the things with COVID is, you know, people have a sense that they can't control anything. You know, there's a sense of victimization or passivity, and to change that, I think it is important that people feel like they can do something about this. You know, it's not all happening to them. They have a sense of agency, that they can change what is being done to them. You know, the virus is coming and so on. I mean, I tell people that the advice of the authorities is very sound. It is not new. This has been going on for over 100 years. And if people wash their hands, wear a mask, and keep social distancing, your risk of contracting this condition will go down drastically. So we go through that. From the mental health perspective, it becomes very simple, easy. You have to have a good work-life balance, which is doubly challenging when you're only at home. So you have to establish boundaries between your work at home and your home duties. And people have found that challenging. You know, the kids are online, everybody's, you know, the internet is overloaded, you can hear the other person. So there's a lot of tension at home nowadays. People are feeling that. So we recommend that people take time out and have rest and relaxation built into their days, because the work flows into the night and nights flow into day. And, you know, it's very confusing to a lot of people. They're very disoriented. So one of the things that I have been telling people is to try to externalize your distress. You know, you can't control things, so you try to help other people. And one of the things to do is to help other people in other ways. For instance, you know, people have been very innovative online. You would have heard of, you know, people doing, you know, making masks and buying groceries for people, you know, and the importance of family and friendships have been underlined during this COVID. I have received calls from friends I've not talked to in 30 years. So I think people realize, even the introverted, asocial ones have realized that, geez, you know, I really need friends, and friends are valuable. So it's a sort of process of understanding oneself and clarifying who you are and clarifying your values.
Thank you. That's some very good positive notes of inspiration for all of us as we go through this and as we all start re-entering into society. We have time for one more question. I would just like to ask Butch, can you tell us, are you at full capacity now, or you were saying now that the automotive business is coming back on, what's your prospects for the next 30, 60 days? Give us a quick upshot.
Okay, so our workforce was laid off about 45 days or so. We fall under critical manufacturing because of automotive. We have on the 27th of April, we came back full up. We took our third shift and kind of put it into first and second shift, if you will, just to round out those two shifts. As we had a lot of people that were in training. And so we were just revalidating, getting everybody used to being back in the swing of things, you know, keeping everybody up to speed on what they needed to do as far as executing production and manufacturing quality processes. Have I lost you? Can you still hear me?
Yes, that's great. And thank you for those comments. We wish a lot of luck up to Rane Company and Lambton as they re-enter. I'd like to also ask our one of our hosts of this cross-border discussion, Mr. Prabhu Hariharan from the Canadian Consulate, to just say a few words, and/or we thank you very much for your assistance in getting this group going. So thank you very much.
David, David, thank you for the opportunity to speak. I really appreciate it. I want to begin by thanking all the panelists for their insight and express my gratitude to Anita Nainen at the Georgia Indo-American Chamber of Commerce for this opportunity to co-host and sponsor this event. Really appreciate that. Now, you may all notice I am a Canadian of Indian origin, and I've been a career diplomat with the Canadian government for about 15 years. We are amidst some strange and unprecedented times. I know the government of Canada is taking a very measured approach towards normalization, placing health and well-being, physical and mental, at the forefront of our planning. The pandemic, I think, has really made us realize that personal relationships, friendships are very important. And we are looking forward to getting back to the ability to spend time with each other outside of Zoom and Microsoft Teams and WhatsApp and FaceTime. Now, I do want to talk about the relationship between Canada, the US, and Mexico, and I'll raise the context as to why towards the end of my remarks. We three countries share a very unique relationship. The US-Canada relationship has been a model for the world. It's balanced, it's fair, and supports growth and innovation in both our countries. And no two other countries share a relationship where $1.4 million of trade occur every minute, with nearly $2 billion worth of goods and services crossing the border every day. Now, the modernization of NAFTA marks an important milestone in the evolution of this relationship with the US, Canada, and Mexico. It is a beneficial and balanced outcome for all three countries. It effectively preserves NAFTA market access, meaning there'll be no new tariffs between the NAFTA parties. Canada complements the US economy and its companies with our free trade agreements with G7 countries, with preferential access to 51 countries through 14 trade agreements, representing 2/3 of the world's output of goods and services. This is the largest free trade zone in the world, with 22 trillion regional market of more than 480 million customers. Now, why do I mention this? The current pandemic allows us to leverage Canada's role in two specific areas. The need to near source valuable goods to support resilience. With existing relationships between Canada, the US, and Mexico, it presents us an opportunity to near source goods and talent with reliable partners, geographic partners, in a reasonably accessible geographic location. Now, I think accessibility to PPE, medical equipment, medicines, etc., is an example of this. The second reason I mention this is because the diversification of supply chains is very important. For example, India, Eastern Europe, Vietnam, and other countries also offer an opportunity to diversify our supply chains. India, for example, has an amazing generic pharma industry, and Eastern Europe has strong manufacturing capacities. Now, companies can make use of Canada's free trade agreements with some of these regions to support the North American economy, and especially in times of pandemics such as this. Now, what this crisis has shown us is that we're in together. Globalization, while reducing poverty and increasing market access across the world, also comes with a risk. And to mitigate this risk, we have to be proactive. In that vein, the Canadian Consulate General in Atlanta has the unique advantage of being able to support companies in the southeastern United States to explore these opportunities. And we're very lucky to have David Weiner, my supervisor, who's really an expert in the North American trade area, to be able to support me on this. So please do reach out to him or me if we can support your organizations in any way. And stay well and stay healthy.
Thank you, Prabhu. And yes, we are very, very honored to have our Canadian colleagues share on this event. And we are thrilled to hear your perspective on the Canadian perspective of the US MSA agreement. Thank you. So that wraps up our seminar today. I would like to thank all of our honored and respected panelists and all of the people who signed in for this. And we will continue to bring interesting and timely webinars in the near future. So this is David Gault signing off for the Georgia Indo-American Chamber of Commerce. And I wish you all a very good day and a very healthy future. Thank you.
I just want to add one thing. This is Raj with GIACC. The webinar will be available as a recording in our website at www.giacc.net tomorrow. You can see this entire recording and you can share it with your colleagues and friends. Thank you.
Thank you.
Thank you.
Bye.